So you're going to watch this video on a screen, and when it's done, you're probably going to go back to another screen. And before you watch this, you were likely on a screen as well. And that is life right now for all of us, most of us, and mine too. However, here's what nobody's telling you. The way you're doing it is slowly impacting your eyes. Today I'm going to break down a condition called computer vision syndrome, also known as digital eye strain. So I'm going to talk about what it is, what it's doing to your body, and exactly how to stop it. So no gimmicks, no expensive gadgets, just simple habits that actually work. So I've spent my career watching people kind of damage their eyes, not just intentionally, but through sheer ignorance of how their visual system works. And computer vision syndrome, CVS, is one of the most underdiagnosed and most underappreciated conditions I see in my clinic every single day. So let's fix that. So first things first, what is computer vision syndrome or CVS? So CVS, think of it as a repetitive stress disorder, just like carpal tunnel, but for your entire visual and musculoskeletal system. So here's what's happening. When you sit in front of a screen, sometimes for hours, your eyes are doing something incredibly repetitive. You're shifting back and forth, screen to keyboard, keyboard to document, document to screen again, or to your phone over and over all day long. And on top of that, you are staring at a light-emitting device up close with reduced blink rates in artificially lit environments, probably with your head jutting forward like a vulture. And your eyes were not designed for this, and your body lets you know. So the most common symptoms I see are, tension headaches, usually right across your forehead or around the eyebrows, eye strain and pressure behind the eyes, burning, dryness, that greedy, sandy feeling, blurry vision, then that comes and goes, sometimes even double vision, especially late in the day, and of course neck and shoulder and upper back tension. I'm sure one of these sounds familiar to you. Here's what I need you to understand. There is no single cure for CVS. Anyone selling you one is kind of lying to you, and that is the whole point to this video. There are proven effective strategies to manage it completely if you actually do them. If you actually do them is the whole game. So here's what I tell my patients. The problem isn't just the screen. The problem is that you have no system around the screen. So you sit down, you lock in, 2 hours disappear. Your eyes haven't moved from a fixed focal distance. Your blink rate has dropped from a normal 15 to 20 seconds per minute down to maybe 5 or 6. Your neck is forward, you haven't had water, and you wonder why your head is hurting at 3 p.m. This is a habit problem, not a willpower problem, and certainly not a systems problem. So I love James Clear's book called Atomic Habits for exactly this reason. He talks about the power of compounding. Small habits done consistently compound over time the same way interest compounds in a bank account. So the net benefit is far greater than you ever expect. So his 4-step framework, cue, craving, response, reward, is the blueprint for building habits that actually stick. For CVS management, the most important piece is the cue. A cue is the trigger that prompts your brain to take action. So set up the environment, cues in your environment, and the habits take care of themselves. And that's what we are building today. So before we talk about habits, your environment has to be right, because even perfect habits fall into a broken environment. The first thing we are going to talk about is lighting. Overhead fluorescent lighting, about 20 to 70 foot handle candles with zero glare on your monitor. That means no windows directly behind or in front of you. If your screen is competing with sunlight or a bright overhead lamp, your eyes are working overtime just to see clearly. Adjustable desk lamp aimed at your keyboard and paperwork and not at the screen is ideal. So next is the distance and the position of the monitor. So follow what I call the 1 to 2 to 10 rule. Phones or tablets should be around 1 foot from your eyes and propped up high so you're not bending your neck too much. So laptops or desktops should be about 2.5 feet and TV at least about 10 feet. Your monitor should sit slightly below your horizontal eye line, and the center of the monitor should be about 10 to 20 degrees down at a downward angle. You should be able to see the full screen without tilting your head too much. If you have a laptop, a stand helps and your neck will thank you. So next is ergonomics. So when you're sitting, your hips should be slightly higher than your knees and your feet should be on the floor. Your back should be straight, shoulders should be relaxed, arms should be resting at your sides, elbows at 90 degrees when you're typing. Keyboard and the mouse should be on the same level. I understand these habits are not always possible, but it's awareness that helps correct them. And this matters because Computer vision syndrome isn't just an eye problem. The tension you feel in your neck and your shoulder is feeding back into your visual fatigue. So fix your posture and you reduce the load on your entire system. So next is monitor brightness. So the general rule is to match the brightness of your screen to the ambient light. If the room changes, and it does throughout the day, especially near windows, adjust your brightness. Your screen should feel comfortable at all times. So not too bright, not too dim. Your eyes are constantly recalibrating when there is a mismatch, and that costs energy. Then comes visual cues. So put a water bottle right on your desk in your line of sight. Also setting a vibrating alarm. Also keep a pair of your computer glasses next to your computer so you don't forget. Ideally, having a single vision computer or near glasses or computer progressive glasses is what I recommend. Again, not saying that that conventional progressives won't work. This is the section that matters most. These are the habits. Let's go through them one by one. So habit number 1 is the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for about 20 seconds. So this has become popular, but remember, it's just a remembering technique. So it's called the Pomodoro 20-20-20 technique, and it is the single most effective thing that you can do for your eyes during screen time. So when you hold your focus at a close range for extended periods, the muscle inside your eye called the ciliary muscles stay contracted. They never get a break. So the 20-20-20 rule forces a reset. So the key is the cue. So setting a vibrating alarm every 20 minutes or so. When it goes off, you look up, you count consciously if you want in your head 20 seconds, and that's it, you're done. Then you go back. So over time, this becomes automatic. Alarm fires, your eyes go up, you don't even think about it. Habit number 2 is blinking. So during every 20 seconds break, I want you to do about 4 to 5 complete blinking exercises. So here's the key word, complete. So the thing is, when we stare at screens, our blink rates drops dramatically. And the blinks we do are usually incomplete. The upper and the lower lids don't actually meet. That means that the tear film isn't being refreshed properly. The oil glands in your lids aren't being expressed, and your ocular surface starts to break down. So here's what I tell my patients. So every minute or so, gently close your eyes, squeeze them, kind of roll them if you like, blink, 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 or just little blinks with a little bit of squeeze. So it's just squeezing like a rolling, like a rug, expresses the glands and releases the oils to protect the tear film. The key is doing it consistently. It protects your tear film, it preserves your meibomian glands, or the oil glands in your eyelids that are critical for the tear stability. So this one habit alone can make a measurable difference in dry eye symptoms over months. So now habit number 3. So take longer breaks every about 2 hours. So the 20-20-20 rule kind of handles your micro breaks, but every 2 hours you need a real break. Minimum 10 minutes away from the screen entirely. Now use this time wisely. Use it to do some stretches. Actually stretch, neck rolls, shoulder rolls, upper back extensions, hip flexor stretches. If you're at a standing working station, your musculoskeletal system needs this. The tension you build up over 2 hours of focused work doesn't disappear on its own. Habit number 4 is drink water consistently. So dehydration is a direct contributor to headaches and dry eyes. And most people working at a screen are chronically, mildly dehydrated. So that water bottle I told you to put on your desk, use your 20 seconds or so to take a sip. You've built the cue, the alarm fires, you look up, you blink, you drink. That's a complete micro habit stack every 20 minutes or so. So habit number 5 is to wear your glasses every time. If you have a prescription, wear it. Especially if you have low farsightedness or astigmatism. These are the errors that people often go uncorrected because they kind of see okay, but the visual system is working hard to compensate. And that effort is a major driver of computer vision syndrome symptoms. Again, make it a cue. When you sit down at your workstation, your glasses on, leave them right next to the keyboard, make it automatic. So get anti-reflective coating, get blue light filter if you like. Not necessary. These aren't luxuries, they are tools. Habit number 6 is artificial tears when needed. If your eyes feel dry, greedy, or irritated, do use artificial tears, 1 or 2 drops as needed. If you're suffering from dry eyes regularly, going preservative-free helps. So preserved drops used frequently can actually irritate the ocular system over time. So artificial tears are not a cure, but they are appropriate supportive care during heavy screen exposure. One more thing, watch for air vents or fans blowing directly at your face. that accelerates tear evaporation significantly. So adjust your workspace. If you are in a dry environment, especially during winter, a humidifier can genuinely help. Habit number 7, try not to work in your contact lenses. I know this one's controversial, but contact lenses on a screen all day is a recipe for dry eye disease. So lenses disrupt the tear film, reduce oxygen to the cornea, and when combined with the reduced blink rate from screen work, you're setting yourself for chronic ocular surface problems over time. So when you're at your desk for extended sessions, make sure to wear your glasses. So CVS management doesn't stop when you close your laptop. What you do at home matters just as much. So things like hot compresses for your eyelids. So this one I can't stress enough. Use a moist heated eye mask, usually microwavable ones or electric ones, and apply it to your closed eyes for at least 5 minutes, about 3 times a week, if not more. And here's why this matters. Your eyelids are lined with meibomian glands. These are oil glands that produces oil that open along the lid margins. So that oil is critical. It sits on the top of your tear film and prevents it from evaporating too fast, too quickly. So when those glands get clogged, and they do, especially with screen use, they reduce blinking, they stop functioning, and eventually they can drop out, they can disintegrate. They don't grow and they don't grow back. So hot compresses liquefies the oil inside those glands and keeps them clear and functional. This is a long-term ocular surface preservation. Patients I see who's been doing this for years have dramatically healthier lids than those who haven't. So again, build the cue. Keep the eye mask next to your bed. Put it on while you're watching something or winding down. Just 5 minutes to 7 minutes and you're done. Make sure to protect your sleep. So blue light from screens suppresses melatonin production that disrupts the sleep onset. So wearing blue light filter glasses if you're on screens in the evening, also turning on the night mode on your devices, and ideally stop using screens entirely at least 1 hour before bed. I know, but your eyes heal while you sleep. Specifically, the ocular surface repairs itself during sleep. So skimping on that recovery time has downstream consequences. Ideally, getting 7 to 8 hours is great, but if you have incomplete eyelid closure, which is more common than you think, a sleep mask, a specialized sleep mask with inside pockets and a lubricating gel drop at bedtime can make a real difference. Also, make sure to get outside. So 1 or 2 hours of outdoor time is critical daily, and this can be anything: a walk, a drive with the windows down, gardening. The combination of natural light, distance viewing, and time away from close work is profoundly beneficial for your eyes. So this is especially critical for children, where outdoor time is one of the most powerful protective factors against myopia progression. But adults benefit too. So let me recap what we have covered so far. So CVS, again, is a repetitive stress disorder. It's not in your head. The symptoms are real and they compound over time if you ignore them. So the fix is a systems approach. Set up your workstation right, build the right habits, and protect your recovery time. So the 20-20-20 rule, the complete blinks, 2-hour breaks with real stretching or catching some sunlight, hydration, hot compresses, and lid hygiene at home, and also getting some outdoor time. None of this is hard, it's just consistent, and key is to make it effortless. Now, on an important note, if you've been doing everything right and you're still suffering after 4 weeks, that's a signal that something else is going on. So uncorrected refractive error, like a meibomian gland dysfunction, possibly binocular vision problem, these are all required for a proper clinical assessment. So comprehensive eye exam can do wonders. If you found this video useful, please do subscribe. I put out content every week on ocular surface health, dry eye, myopia management, and preventative eye care. Because the stuff most people don't know about their eyes is the stuff that matters most. I'm Dr. J, your ocular wellness doc, and remember, eyes don't lie. And I'll see you in the next one.